Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and I'm going to round up again the key COVID-19 issues as they relate to the dental sector. First thing I wanted to talk about this week is NHS contractual frameworks. So we continue to make the case for clarity around the various NHS contractual frameworks across the UK. Frustratingly, in England, we still don't know what the abatement percentage is going to be that's going to be applied to contracts, and we know that's causing huge anxiety amongst dentists and dental teams. We're continuing to argue to get that figure as low as we can, and we'll keep you posted on how we get on with that. In Northern Ireland, we're seeking clarification on a number of outstanding issues with the financial package, and in Scotland we've been getting a lot of queries from members, and we met with the Chief Dental Officer yesterday to discuss some of those issues. As ever, we'll keep you posted when we hear anything, and we'll report back to you. The next issue I wanted to talk about this week is PPE, personal protective equipment. So PPE continues to feature in the news across the board, and we were pleased to see the government acknowledging this week the shortages in PPE facing our members working in England's urgent care system. We've been raising this issue consistently with Jo Churchill. She expressed her concern at the situation, telling parliamentarians there had been delays for a number of urgent care centres in getting PPE, and that this was still an ongoing issue for some hubs. She said that the government was working urgently to resolve things, so we'll keep an eye on that. NHS England had previously said that every centre had the relevant PPE, in contrast to the evidence that we'd provided from over 1,000 dentists working on the front line. I've also been talking this week to contacts across the industry who are concerned about ongoing shortages, which are continuing to limit patient access to care. So we'll continue to keep you updated on PPE issues as we hear them. The next issue I wanted to talk about was preparing for the post-lockdown period. How dentistry moves forward once lockdown is lifted is one of the key issues we're discussing at the moment and will be across the coming weeks. Both our board, our Principal Executive Committee, and our Health and Science Committee had detailed discussion about how we prepare for that this week. We're in regular contact with international colleagues, and we've got some content coming on that shortly, so look out for that on the website next week. So today, Friday, we've submitted evidence to the House of Commons Health and Social Care Committee. They're holding a new inquiry into delivering core NHS care services during the pandemic and beyond, and clearly we focused on the provision of dental care in that context. In Scotland, we met with the Chief Dental Officer and Scottish Government regarding a phased return to dental practice, talked about post-pandemic dentistry, the importance of testing, suitable PPE, clear patient journey, and an appropriate funding model. And the Scottish Government is working up proposals which they'll share with us pretty soon. In Wales, early work is going on the contractual framework, and in England next week we're going to join NHS England's group looking at the issues, and Mick Armstrong this week joined the Faculty of General Dental Practices working group on the way forward. So lots of work going on in that area, and we'll keep you up to date on that. A few final thoughts this week. Firstly, on advice. We know members have an awful lot of queries at the moment, and we're keeping our coronavirus web pages up to date frequently. And we're also working to provide more one-to-one advice than we normally do. Traffic to our advisors around 5 times what it normally is. Our aim is still to get back to you within 2 working days, so we appreciate your patience while we deal with your queries. Doing our best to continue to provide you with accurate and reliable support that you've always received from us. Our contract resolution service is particularly busy as we seek to help resolve differences of opinion over NHS contractual payments. Just finally, on reading, we've got some important blogs this week. Susie Sanderson is discussing antibiotics and when it's appropriate to prescribe them, and the harm of overprescription. Practice owner in Lancashire tells us how he set up 2 urgent care centres and how the pandemic has exposed cracks in the funding of NHS dentistry. And on that note, if you haven't read our piece on the PDS and how they're leading the way on urgent care in Scotland, I do recommend that. And we've also got some very useful blogs on Northern Ireland and changes to the financial support scheme that I would recommend. So that's all from me this week. Wishing you a healthy long weekend, and speak to you again next week.